Good morning and welcome to the chat on Newsday Amarillo and News Channel 10.2. I'm David Lovejoy
And I'm the Minister of Mirth, Chuckalicious Chuck Williams.
and Miss Rhonda Rhodes away from the desk this morning. Hope she's having a great time down in Metroplex watching her son get in some soccer, the football as they call it. Right now, we're going to sit down with Dr. Zack Parker. He's with the Amarillo Regenerative Medicine Center here in Amarillo, Texas. He's going to stop by and talk about how you can take care of your body, avoid surgery, and get relief from pain. Dr. Parker, welcome to the chat. How are you doing today?
I'm doing fantastic. Thank you. Thank you very much for having me.
Well, first off, just to get a base for this, explain exactly what is regenerative medicine.
Well, regenerative medicine is a very simple form of medicine that uses the natural biologics in the body, natural tissues and cells to actually rebuild tissue, repair tissue, and regenerate tissue in the body rather than using medications or surgery. And so it's a much more natural process. It's the way our body naturally heals in the first place. We're just doing it in a more concentrated form so that we can get even greater outcomes for it.
Dr. Parker, it seems to me when you say regenerative medicine, we're talking about stuff that's all the way in the future. I mean, regenerative medicine has come a long way in the last 10 years, has it not?
It has. The study of it, it has been one of the most highly studied and highly funded areas of medicine because of what it promises that it does hold. And so it has come, quite a drastic way in the last, really it's been studied for about 30 years, but the last 5 to 10 years it's really made some huge ways forward. And it's just exciting to see what it's been able to help, what kind of things it's been able to treat, take care of. And specifically, as far as the approval for it and things of that nature, we're seeing a lot used for chronic joint pain and issues like that. It's really making some miraculous changes for patients that may not want surgery or may not be a good candidate for surgery because of heart issues or something like that.
Doctor, what advantages does regenerative medicine have over the traditional treatments? The cortisone shots, the inflammation, the pain pills, or replacement surgeries even.
Yeah, honestly, the first thing and the biggest change is and biggest advantage is that it's just safer. It's extremely safe. We'll talk about maybe some statistics about that here in a second, but you're using natural biological components, so there is no real risk of reactions to the medication or side effects from the medication. You don't have downtime like you would with surgery. That's one of the biggest things that patients talk about that they like about the procedure is we don't have an extended downtime or recovery or things of that nature. And just the safety and the efficacy of the procedure itself. And honestly, in head-to-head studies, it actually has better results and outcomes than surgical procedures. So,
wow.
Whoa. Well, if that's the case, how successful is a I talk for a living.
it's a mouthful.
Yeah, how about it? How successful is it? I mean, do you see cases come back after regenerative procedures have been done? How effective is it?
Well, let's just take a simple study that was done out of University of California, Berkeley, and they actually took about 446 patients that were all set up for a knee replacement because they were told they were bone on bone, needed a knee replacement, and half of them had surgery, half of them had regenerative medicine done. The success rate in surgery was about 50% of the patients got at least 65% better.
Whoa.
But the kicker on that was there's about a 10 to 20% complication rate with surgery. You have, the risk of, 2 people died in that study. You have risk of infection. You have risk for, things like blood clots, issues with anesthesia, things like that. The regenerative medicine group that was studied, there was a 0% complication rate, but an 85 to 90% success rate and getting at least 65% improvement. So one, the risk is much lower and the reward is much higher. So, while surgery sometimes can't be avoided, and there are cases that we recommend for surgery,
Mhm.
I definitely feel like regenerative medicine is something patients should look at and consider before they go down that route of surgery, for sure.
You talked about the danger sometimes of surgery. Earlier, you talked about sometimes maybe you're physically not able because of heart issues, something to deal with the surgery. That brings me to the question: who's the candidate for the procedure for regenerative medicine? Who is the person who can move forward with this type of treatment?
Well, definitely anybody that's having chronic joint pain. And the nice thing is this can be used for pretty much any joint. It can be used for the knees. It can be used for hips, shoulders, for spinal conditions,
Right.
for neck and back. We've done ankles. We've done elbows. Anybody suffering from chronic pain that is not getting relief from any of the traditional methods doesn't nowadays medications are, they're seeing more and more danger with ibuprofen and heart issues and a lot of those things. So anyone that doesn't want to have surgery for any of those reasons, anybody that doesn't want the downtime, but also specifically people that are not a good candidate for surgery. I can't have surgery because of some concern about anesthesia or concern about heart conditions. This is maybe the only choice they have for pain relief outside of, because they can't have the surgery. It might be the most ideal for those patients for sure. But I mean, we can treat everything from a partial tear of a muscle or a partial tear of a ligament or a tendon to a meniscus tear to just degenerative bone-on-bone issues from wear and tear.
I understand you have a special opportunity for our chat listeners who would like to learn more about this. Can you tell me about this?
Yes, sir. So many people, this is just a new topic and they're not as familiar with it. It's not, it hasn't been the normal treatment. And
Right.
so many people just want to find out more, find out if they're a good candidate for it. And so one thing that we want to make sure and make available to your listeners today and to the viewers today is an opportunity. We do offer a free consultation for this in our office. And anybody that would like to take advantage of that are more than welcome to come in for that. But we also offer a discounted examination to make sure a patient is a good fit. Not everybody is an ideal fit for this procedure, and but we also want to make that as minimal a risk for patients. So if anyone would like to come in from the chat for that, we do that exam. We do X-rays. We do an orthopedic exam. We also do a functional neurological exam to check to make sure everything is ideal for that patient and that candidate as possible. Normally, that's about a $249 exam. We were offering it for anybody on the chat that'd like to take advantage of the exam to find out if they are a good patient for it. We offer that. It's just a $47 exam for anybody that would like to do that and find out more. And in all actuality, if a patient is not a good fit, I usually don't charge that $47.
Wow.
I'll refund it to the patient. So
Whoa.
really no risk to find out if it's something that's right for you.
Is there any parameters on age, doctor? Is it someone who's too young or maybe too old to try this treatment?
Well, we've had patients all the way in their 90s that have done this procedure and had great success with it. But as far as age, there are some treatments that might be more fitting for someone younger before they have to take as extreme of a procedure as this is. I say extreme, it's just there's levels of different types of regenerative medicine. And so there are some other treatments that might be available for someone that's a little bit younger that they might do just as good with. So we always investigate all those and try and find the most ideal treatment and answer and correction for that patient, depending on each and every patient's individual, health and age and those things for sure.
$47 is a way you can find out the end pain. And if you know anybody who's had to suffer through hip, ankle, knee, joint, it takes away from the quality of life. Let's be
Right.
honest.
Absolutely.
Yeah.
Absolutely.
And
You
it
miss out.
sounds it sounds to me that it sure beats taking Tylenol and Aleve for the
Oh,
rest of your life.
Well, yeah, I mean, you talk about the medications, Tylenol and Aleve are going to be, they're some of the highest reasons for kidney and liver issues in the country.
Right.
And the ibuprofen is, you have almost 10,000 people a year that die from stomach ulcers from medications. We think they're safe because they're over the counter, but there's so many complications. So it is, yeah, definitely. And you're looking not only to get rid of the pain, but the other thing about regenerative medicine is it restores the function of the joint, so that you have better mobility, you have better strength. So you also get, a lot of other benefits from it besides just the pain relief. But if you live in chronic pain, get rid of the pain is plenty plenty
Right.
reasons to do it for sure.
We were talking before we came on air, and we were talking about the holidays, and the doctor was talking about he really fun, exciting around his household this holiday season because he got a new grandbaby. If you're in pain, you're not getting down on the floor and playing with that grandbaby. If you withdraw, you pull away when you're going through physical and suffering pain, and you can end that though. And just for $47, you can find out if you're a candidate for regenerative medicine. It is. Like I say, you avoid the surgery, you avoid the downtime, you avoid the dangers of taking over the counter and prescription medications. Give Dr. Parker and his people a call. They're at the Amarillo Regenerative Medicine Center. It's located at 1934 Civic Circle. They have a phone number there, 806-410-6584. They open up on Monday morning, 7 a.m. They have some hours that fit around your schedule. And doctor, what should a person bring when they come into your office? What do they need, and what should they bring to you?
Well, if they come medical history, any medications they may be taking, if they've had any previous imaging, an MRI results or any other previous x-rays, that would obviously make things much faster and much easier as well. But also just something comfortable. If we're checking a knee or hips, a pair of shorts maybe, just so that it's easier to examine the area. Or we can always gown them if we need to. But yeah, that's the main things that they need, and that way we can get the and come with some hope and a little aspiration to have a better quality of life. That's the biggest thing. Is just come with a good outlook
Right.
that there's something different that can be done.
For
An open mind, I guess, would be the right answer.
For $47, you can start down that path to a pain-free future. Trust me, once you can get up and move and feel and join, get back in the game of life, it will change how you feel. Give the doctor and his great folks a call at the Amarillo Regenerative Medicine Center, located at 1934 Civic Circle. Their phone number, 806-410-6584. A special going on right now. You go in or you call them and tell them you're a chat listener or viewer. $47 to get checked out and see if you're a candidate for a new life. Dr. Parker, great info. We really appreciate this. And, we hear all the news and the headlines of pain and the addiction sometimes involved with it, the surgery nightmares. There's great to have an alternative source to look at things, isn't it?
Absolutely. That's just it. For the longest time, people didn't really have a choice. It was either the medications or it was the surgery.
Right.
And sometimes, sometimes it's just not the right fit. It's not the right choice for somebody. It is great. And it's exciting to see, just see the success with it. And I tell you, as a physician in this area, it's so fun to work with these patients and see how excited they are to get back to doing the things they want to do, whether it's traveling with their spouse or whether it's playing with the grandkids, like you said, getting that on the floor. It's just great to see people recover their life and begin to enjoy things again, and just to see a smile back on their faces for sure.
That's a great one. Recover your life. That's a great way to put it. You recover your life back again and be part of the game. Visit Dr. Parker and his great folks, Amarillo Regenerative Medicine Center. They're open Monday through Thursday, 7 a.m. to 5 on Monday, Tuesday, 2 to 5 on Wednesday, 7 a.m. to 5 on Thursday, 806-410-6584, 1934 Civic Circle, $47 to get you back on the path to recovering life. Dr. Parker, great information. Thank you so much for your time this morning.
Absolutely. Thank you, guys. Have a blessed day.
You too. Be careful. We're going to take a quick break. We're back with more chat right after this.